Hi, thank you for joining us. My name is Dana Cooper, and I am the Executive Director for the Nurse Practitioners Association of Ontario, or NPAO. We're celebrating nurse practitioners in Ontario and the wide-ranging and valuable contributions they make to healthcare every day. By meeting some of the nurse practitioners and get an introduction on what they do and where the needs for healthcare are in this community from the nurse practitioner perspective. Today, we're talking with Valerie Cooper. Valerie is the co-chair of the NPAO's Palliative and End-of-Life Care Community of Practice. Welcome, Valerie. Thank you for taking the time.
Thanks so much for having me. So, sorry, go ahead, Dana.
No, I was just going to ask you to take a few minutes to tell us about yourself and your experiences.
Perfect. So I work in community-based palliative care in the Kingston area, or the southeast part of Ontario, for home and community care support services. Used to be the LIN, used to be CCAC. And I've been in this role now for just over 7 years. My background prior to becoming a nurse practitioner was in the ICU. And then I also worked as an NP for the acute pain management service here at Kingston General Hospital. So my background has been definitely focused on symptom management for quite some time.
But in a variety of settings.
Mm-hmm. Yeah, and so in this role in the community, I see patients in their homes, some in Kingston proper and some an hour and a half north, very rural. So my geography is vast and varied, which is lovely. It means every day is different. And I work in a shared care model with the patient's primary care provider. So I like to say I run the show from Monday to Friday, and then the primary care provider is available to the nurses after hours and on the weekends, should something unexpected come up.
Great, wonderful. So you work with the Palliative and End-of-Life Care Community of Practice. You're the co-chair. Tell me about the work from that community of practice.
Well, we are sort of just getting our feet wet in regards to restarting meetings. I think over COVID, a lot of the community of practices sort of took a little bit of a hiatus. And so we're sort of just trying to figure out what our members would like out of the community of practice moving forward. We did have one meeting last week, I believe, with a few members, and shared some insights in relation to community practice and long-term care practice as far as supporting patients at the end of life. It was a nice opportunity to share differences and similarities in practice settings, and to just sort of have an opportunity to debrief a little bit. And I think that is a really important opportunity for those of us working in end-of-life care to have. So if that's what the community of practice becomes, a safe place to share concerns and successes, that's wonderful. One thought came up that perhaps we might do some outreach to some of the other communities of practice in regards to supporting and encouraging discussion of end-of-life care and patient preferences, advanced care planning, goals of care conversations with some of the other communities of practice, in order to sort of improve accessibility and understanding of the importance of this sort of specialty yet generalizable area of practice that we all have a responsibility to be a part of.
You raised an interesting question there about what has the impact of COVID had in the palliative and end-of-life care area?
I think it's definitely focused patients and families' desire on being at home even more strongly than before. Before COVID, we knew that most Canadians, and the stat was about 70% of Canadians wanted to die at home, and yet only about 15% of them actually were able to. And so I think knowing that being in hospital created a lot of issues with visitation and the availability of family being present at the end of life, basically encourage people to look more seriously at dying at home, which I think is a good thing, because dying isn't a medical procedure. It is a social and community-based and emotional process more than anything that may require some medical support at times. One of the concerns that has come out of that, though, is that as the pandemic has progressed, we've lost quite a number of staff in the community setting, and that is straining our ability to be able to support patients and families to remain at home. I think that's one of the biggest concerns with community-based care, whether that's palliative care or other types of care that should and needs to be available in the community, is that we are having a very serious health human resources crisis. And it's definitely impacting not only the people in the community, but also further up in the healthcare system, because people aren't able to be decanted out of hospitals at the rate that they should be, or we would like them to be, because of the lack of support.
Well, that's an issue that's permeating throughout healthcare right now. But Valerie, if you could wave your magic wand, what is the greatest needs? What would you change? What would you add? What would you do to improve patient care in this space?
I think having the support from our allied health, from our nursing colleagues, PSWs, OTs, PTs, social workers in the community. I think there's been, because of COVID, a push for understanding a bit more about the needs in the community, and recognizing that not only is it what people want, but also it's a financially more viable place to provide care for patients. And so I think focusing on the skills and the quality of the care that can be provided in the community, and it, rather than it being sort of the ugly stepchild of acute care institution-based healthcare, that it become the gold standard. I know in my nursing education and my nurse practitioner education, I had no community-based experience as far as being in patients' homes and seeing them in their own setting. And when I took this role as a nurse practitioner and went out to see my first patient, my eyes were completely opened to how beneficial it was to see patients in their own environment, and also how skilled as a healthcare provider you need to be in order to care for patients at home. It's not like the hospital where you walk out into the hallway and say, can you come here and look at this? Or I need help with this, right? You're the one person in that home who needs to address an issue right now. And so I don't think our community colleagues get enough respect for the amount of skill and resourcefulness and compassion that they have for individuals that they care for in the community.
Well, and that's another great point, the interprofessional care and the collaboration that takes place, that NPs are very much a central part of. And it brings to me a question about, is there a variety of roles that NPs play in this area, or are they, what kind of roles do they perform?
So we, the NPs that have similar roles to myself, I think there are about 70 of these positions across the province, and they're housed within the home care organization, or what we know as home care right now. But there are many NPs who work in primary care who also provide palliative care for their patients. I think that's a really important thing to understand about palliative care, that it's not only a specialist practice, but it's also a generalist practice. And the expectation should be that anybody who's caring for an individual who has a life-limiting diagnosis, regardless of where they are in their trajectory, is able to approach that patient from a palliative care approach perspective, meaning basically symptom management and holistic care, which I think NPs are fantastic at. I think that's one of the best things about being a nurse practitioner, is that we have a complete understanding of the individual as a whole and where they've come from and who they are now, and can really help them to see where this illness journey is going to go. And so I think my colleagues in primary care do a wonderful job of being able to support in their patients through their illness journey, and perhaps just need a little bit of support at sort of the end of life, when our society as a whole is less familiar with what's going to happen in that area or that segment of that disease journey. So I've partnered with a number of nurse practitioners in the shared care model, and they're always willing to come out and do joint home visits and be available to their patients. And I think being able to encourage other nurse practitioners to be available in that situation for their patients is really encouraging, because I think we can definitely fill a void there.
Yeah, and I think you bring up a great point, and that's the unique perspective, that nurse practitioners have in the healthcare space, that holistic approach, that compassionate care. you know, it's needed in this area. And the Ontario government just announced yesterday about you know, some more further investments in home care, and so we're going to talk offline as to how NPAO can support palliative and end of life care, you know, by with some requests to the government. NPAO has been advocating with the government of Ontario to enhance medical assistance in dying access by engaging more nurse practitioners. Do you have any comment on that initiative?
Yeah, I think the Ontario government needs to step up and figure out a way to support NPs to provide MAID work outside of their employment setting. There are large areas of this province that do not have access to any MAID assessors or providers. And I think we all wonder that if there was a mechanism for payment for nurse practitioners to step in and be able to fill that void, whether there would remain such unequal access across the province. I'm very lucky in that in my role, I'm able to participate as a MAID assessor within my paid employment. But there are definitely nurse practitioners who would be willing to take on patients outside of paid employment if they were going to be compensated for it. And I don't think that it's fair to ask nurse practitioners to work for free to do something that they feel is needed and that their patients want, just because it's almost taking advantage of our empathy. And I don't think that's fair. We are professionals and we should get compensated for the work that we do.
Yeah, very well put. I mean, that's, I mean, it's compassionate care. There's an area of need, and it's hard to not, you know, step up when that need
One
exists.
of my physician colleagues on one of the communities of practice, or clinician advisory councils I belong to, said, I don't know, it's something different about you nurses. We physicians would never do something like this. You just need to stop doing this. And we all just looked at each other and thought, it's easier said than done, right? When you see a void and see something that your patients need, it is intrinsic in being a nurse that you step up and do what needs to be done. But at the same time, I think we need to recognize when we're being taken advantage of and put our foots down.
Right. Right, and that's very well said too, and nothing exemplifies that more than the last couple of years, for sure. Well, Valerie, I want to thank you so much for taking the time to explain this fascinating aspect of healthcare and the NP role. I did want to ask one more thing, and that's, you know, what makes you proud to be a nurse practitioner in Ontario?
I have to say I've had a number of nurse practitioner roles, and at one point in my life didn't think I would continue being an NP, and I actually found this position and have never been happier. I'm so grateful to be able to find a role in which I'm able to work to my full scope of practice and to incorporate my holistic approach from my nursing background. And really, I think to be able to give the patients and their families the care that not only that they need, but also that they want.
Well said, Valerie. Really, again, I very much appreciate it. Thanks. We were talking with Valerie Cooper, nurse practitioner here in Ontario, co-chair of the NPAO's Palliative and End-of-Life Care Community of Practice. You can find more information about that community of practice or any NPAO community of practice on the NPAO website. But again, celebrating nurse practitioners, and we couldn't think of a greater cause to celebrate. Thanks again, Valerie. And I wish you well.
Thanks.